So good morning, good afternoon, good evening, depending upon where you are in the world. Welcome to Techfugees Live. We're going to be here for an hour. I'm Matthew Gardiner. I work with Techfugees. I'm one of the founding members. We are a charity working with refugees, really focused on bringing tech solutions to refugees and displaced people. We're mainly run by volunteers. The purpose of this broadcast really is to bring more light to our data hub. So we have a data hub at the moment, which is collecting information which is useful for refugees and displaced people. And it's really designed to work for refugees and displaced people and have a lot of input from them. So we've got a good lineup today on our session. We're now presenting from the Greek islands. I'm not on the Greek islands, but some people are. And we have three good speakers today, one from Action for Education, two more speakers from Telecom Without Borders, and another two speakers from AI for Good. So without any further ado, I'd like to introduce Hamdan, who's working for Action for Education. And he's going to give us a brief overview of the situation in the Greek islands for refugees and displaced people at the moment. And then we can talk further about Mo's work there with Action for Education. So welcome to Techfugees Live, Mo. You may be on mute, which is kind of a normal thing to happen. Hi, Mo, are you good? I'm just flicking through my screen. Oh, Mo, you're still on mute. Just wave if you can hear me. Okay, maybe we'll come back to Mo. I wonder, Agnes, Sebastien, would you be good to go if we could talk about your work at Telecom Without Borders globally and also in the Greek islands?
Okay.
Cool, perfect. So yeah, I introduce Agnes and Sebastien from Telecom Without Borders.
Okay. Hello, can you hear me?
Absolutely, perfectly. Okay. Thank you. We see your screen as well. Thank you.
Wonderful, wonderful. Thank you, Manu, for the screen. So let me explain what Telecom Sans Frontières, Telecom Without Borders is about. So Telecom Sans Frontières, TSF, was founded in 1998 as the world's first NGO focusing on emergency response technologies, which means that during humanitarian crises, we give affected people the possibility to contact their loved one and to start to regain control of their life. And we build communication centers for population and humanitarian. It was during the Kosovo War in 1998 that the TSF future founder at that time starting to set humanitarian calling operation to let people call their family using satellite phone, as you can see on the picture. And they realized how much that was a relief for this population. So today, 20 years later, the engagement on first emergency response remain and is essential to TSF identity. But in parallel, TSF has grown and evolved, and the role of technologies in emergency has expanded. So now we make available innovative communication-centered solutions to assist migrant, refugee, displaced people. We still use satellite communication, but we also use, develop, customize, tweak, integrate, adapt, whatever solutions through all means made available in the ICT, internet, social media, instant messaging, mobile phone, software, Raspberry, whatever. TSF core mission, as you can see on the slide, is about humanitarian emergency. So we are present mostly, this is the utmost priority, on natural disasters, earthquake, typhoons. We are present on man-made disasters like conflict or explosion, and also on massive displacement of population. This is what topic we are talking about today, which are often happening after disaster or for wars, conflict. We, beyond emergency response, TSF is also engaged in post-urgency situation and protracted crisis. Like in Mexico, we have developed and deployed information diffusion system to provide local and updated information to the migrant and the asylum seekers in 10 different centers across the country along the migration transit route in Mexico. We are running educational projects supported by ICT tools to help boost schooling in emergency context, like in Turkey with Syrian refugee kids. We are doing capacity training and also supporting isolated communities to use ICT tools as an enabler of local development. And I will let Manu continue and speak about what we're doing on the ground.
Thank you, Agnes. So this pic is just to give an idea of the missions we usually do. So mainly providing emergency communications, as you explained, in emergency situations, like the typhoon Ida and Kenneth in Mozambique 2 years ago. So let's go to Greece now, which is the focus of this Techfugees live session. So TSF was present in the Balkans migratory crisis in 2015 and 16 in 6 hotspots from Serbia to Greece and also in the islands. The type of aid we provided there was mainly Wi-Fi connections, like we are doing now in Lesbos, but also calls. In the case of Idomeni, which was very specific with people in big difficulty there in the spring 2016. Just to say also that the technological means that we put in place depends on the situation. In the Lesbos case, we deployed there in September, just after the fires that destroyed the previous camp in Moria, because as the people were left anywhere in the street, in the fields, with nothing, we considered that they may have a big need in communication to contact their loved ones. When the new camp started to be built, we decided to provide a temporary Wi-Fi connectivity, which is backhauled on a satellite one, as you can see in the picture, with 2 high-density access points. Maybe we'll come back to this later. High density because we expect a lot of people to be connected to them at the same time in the same location. The service is limited because the bandwidth is limited, and also the satellite connection is paid per meg or per gig. So it means that if we have too much traffic, we won't be able to pay. So they have access to messaging and calls like WhatsApp, Telegram, and so on, social networks, and email. Of course, they cannot access any video, because if everyone looks video, it won't work. The last picture I wanted to show you is how we chose the coverage area, because, as I said, we have only 2 access points for a very big camp. So we tried to give access to the connectivity to everyone. So we chose public zones, like, for example, the entrance, where there are administrative services and also medical services. So everyone is expected to go there at some point. And also the second circle on the right is a police checkpoint where every people living in the camp has to go through to go out of the camp. So basically, if you have to queue there, for example, they will have access to the connectivity. So that's all for my presentation. So if you have any question, I don't know if the question are now or later, Matthew.
Well, right now, please do. I didn't say, please do join in at any point if you have any questions. Raise your hand or send them through. I mean, thank you, Emmanuel, for that presentation. You know, I got involved with Médecins Sans Frontières a long time ago, really pre-internet was big, and now we understand that internet access, you know, it's almost been declared a universal human right. It's a very important piece to have in a disaster area. It's the first question anybody who's in a disaster area will ask. So thank you really for providing everything and for talking with us today. We value your time. I wonder, could you tell people, we think setting up Wi-Fi is easy. I'm a techie, I know it isn't, but what exactly is required for anybody who wants to do this, or what do you have to go through when you get on the ground? A question for both you and Agnes.
Actually, I think I will take the question.
Sorry, yes, Sebastien.
Sebastien also work for TSF, and yes, of course, when we think about Wi-Fi nowadays, it's everywhere. So it's part of our life. We think it's really easy to have. But in the situations TSF deploys to, which is natural disasters, camp settings, it's really, I would say, luxury to have Wi-Fi there to get an internet connection. It's really not easy. For the case of Lesbos, it's on an island in a refugee camp, so very regularized by the government. So there is the technical difficulty of getting the connection there. And there is the regulation difficulty discussing with the local actors and everyone to get the authorizations. That's why there we use satellites. And on most of our deployments, we use satellites because it's available everywhere and we can set it up very quickly. Of course, you need to find the equipment, you need to have money to pay for the connection because satellite connections are quite expensive. And then after when you get this satellite connection, then you have to distribute the Wi-Fi for everyone to be able to connect. In refugee camps like Lesbos, we have, I mean, in your office, you will have maybe 30, 50, 100 people connecting to the Wi-Fi, and you will need several access points for that. In a camp like Lesbos, we have between 500 and 900 people connecting every day. That's also a challenge to find the equipment, to fine tune the system for everything to work when that many people are connecting to it. So that's the main challenges we are facing, and that's why we need specialized team like TSF to deploy to these areas to provide an internet connection.
Absolutely, because thank you for elaborating that. Things I didn't know, I'm sure a lot of other people didn't know too. And when you arrived in Moria, and I know you decided to go very quickly, but how long did it take to get set up in a way?
So I should answer as I was the one who installed this connection with my colleagues there. How many times did it? So I have to precise. I said that we are used to this kind of emergency response in telecommunications, and we have, I would say, ready-packed equipment that is already configured. So we are able to deploy relatively quickly and set up depending on the constraints, because I remember that in Lesbos, the main technical difficulty that I had was access to stable electricity. And I think it took more than 1 week until we had a reliable access and that we could set up our whole system.
Okay, right. It still sounds pretty quick to me.
Yeah, that's quick to be honest, but for us, it's not so quick. Yeah.
Okay, and is that because you're using satellites or a different type of link?
Yeah, there is a delay in the activation of the satellite link. That was also a challenge in this case, but we have to compose with the different constraints of every specific situation.
Absolutely. A quick question too, I think from Louise here at Techfugees. She asked, how do you choose which sites to work in? How do you choose the areas to work in? Do you have a rationale? Or...
So we don't really choose, it's more the areas that choose us. So of course there are many disasters and connectivity is an issue in many countries, and especially in disaster. But not all humanitarian crisis requires emergency internet connectivity. In many humanitarian crises, the connectivity is there. So we redeploy to the ones where there is no other solution. We are the last resort. We are the emergency connectivity. And usually as well, our connections are not long-term solutions. We are there until a local solution is found to take over. And then, as I explained, there are there is the technical side, but there is also the authorizations. And in many countries, especially countries that are in conflict, it's more difficult for us to deploy. We've been to Syria, we have connection in Syria, we have been to Iraq, but for example, in Yemen and Myanmar and other countries like this, it's a lot more difficult for us to do anything because of government regulations. So that's what limits our action. The emergency need and the urgency of the need and the regulations, of course.
Okay, perfect. Thank you. It keeps you very busy. And Louise also asked, do you have any examples of the kind of local infrastructure that already exists? So if you wouldn't go to an area because it already has a local infrastructure, can you recall any, or what do they typically look like?
Well, so for example, we can take the example of Greece. We are there in Moria, in Lesbos, because after the fire, the camp was destroyed, and the infrastructures that were there were destroyed with it. And they had to set up a new camp. And that's why we went there very quickly to set up the connection on this new camp. But now we are waiting for local operators, Cosmote in this case, to take over. And they should take over in about 6 months, something like that. So the thing is, most of the time when a crisis arrives, it takes time for long-term solution to be set up. In this case, 1 year, 6 months. So we are there in the meantime. And in Greece, there are many other camps on the mainland, on other islands, where there is connectivity provided by other actors, local providers. So that's why we are there in Lesbos and not on other islands at the moment. Okay,
thank you. And maybe a question that crosses over with some of our work with the Data Hub. I mean, I'm sure you're very busy with, in a disaster crisis relief situation, you're just focused on providing the service. Do you have time to notice the impacts? And if you have time, what have you noticed, or what would you like to notice? This is something we're working on at Techfugees, the Data Hub. We're trying to focus on actually benefits as well and positive things that happen. But do you have time to notice the impacts you have, apart from the obvious ones?
Yes, so of course we're very busy setting up the connection, but once it's set up, when we are there for 6 months, 1 year, we always try to take the time to evaluate the impact of our actions. So we know in the case of Greece, it's a bit more difficult because we operate from France. We've been there on the ground for so we went there 2 times in 2 weeks at a time. So we didn't really have the time to do that. Usually we stay there longer, but here because of COVID regulations, because of other factors, we couldn't stay on site for a very long time. So that's actually what we're trying to do now, is to recruit locally, find someone who could be there for us and do this monitoring and evaluation of the action, trying to speak to the beneficiaries, to the people in the camp, and try to know better how they are using the connection, what it brings to them. But we have a general idea of what they do with it, because Greece is not the only operation we are doing. We have the same kind of connection in Bosnia. We've done many connections like this in the Balkans during the Syrian crisis as well. So we know people use a lot of WhatsApp, of course, and now we see more and more, what's the name of this other, the new Telegram being used. Yeah, Signal. It's more Telegram at the moment to secure their communication and mostly to talk to their families, reconnect with their families, either back in their country or waiting for them in the country they are trying to reach in Europe. And other things they do is try to access information about the situation, what are their rights, how can they ask for asylum, what kind of paperwork they need to do, these kind of things. So that's the two. So there is a protection part, a psychological support part where they talk to their family, and that is also the information part, trying to find how they can ameliorate, improve their situation there.
Okay, wonderful, thank you. So I guess we pick up some general trends from that. Great insightful information. I know in the mental health front we've worked with Peter around Moria before. I'm sure as we move forward, there are more and more synergies to develop, between your work and other agencies working there with tech. We know how tech likes data. So thank you for all of that information. And then finally, we have a lot of techies in our audience. We have quite a lot of volunteers as well, people in the NGO space. If we could give you 200 of techies, 200 coders, 200 NGO volunteers, what would you like them to do, if you even know, if you even want them to work with you? I don't say we can bring 200, but it just brings something to mind. So what could people who are watching now help you with?
Okay, so we are very focused on the telecom part, the network part. So we don't do a lot of development. So developers, we wouldn't need 200 developers.
Okay.
3 developers would be enough to do what we need, I think, good ones. We don't do a lot of developments on the application side. It's more on the network, on the telecom side, on the signal and the interconnection of equipment. But what we need to do that is people on the ground, having people on the ground to set up the equipment. We use a lot of volunteers to work with us on emergencies. And also to stay there, find people who can be there and follow up on our work. Once we've set up the connection, we will deploy from France, do the setup, and then need someone to be there and then follow up on what the action is really providing to the beneficiaries.
Awesome. So people on the ground, that's what the question is, and or the call out to communities today. I think if you can help on the ground, please do. Just got a question here. Do you provide guidance towards any type of content that can meet people's needs? How do you communicate with them to make sure that everyone is fully aware that online solutions can be accessed in the camp? So there's an audience member here just asking, I guess, how do you let people know that you're available, and do you provide any content? I think maybe you answered that already, but
yeah, so
you're mainly focused on the tech.
of this, maybe we have just put some displays, so paper displays in the camp. And the idea is to talk to the people, especially at the beginning when we set up the connection. I mean, the people see us installing the antenna, and we just talk to them. I mean, and then progressively, as we cannot reach anyone in the camp, we put the displays and the how do you say, the mouth words.
Word of mouth, yeah.
Yeah, it should be between the people of the camp.
I'm sure word soon spreads once you've installed everything. Okay, perfect. So again, we don't have much time here. Just 20 minutes for everybody. Was there anything else you wanted to present or say, talk about your work in Greece or globally? All good, right?
I just have one last question, which is not directly related to the telecom work you did in Lesbos, but more access to internet. And you mentioned that there were trouble to access stable electricity. And I was wondering, since charging phones is also like a big challenge in Moria and in other camps, if you had seen any solutions that were helping to access electricity and battery for the phones on site.
Good question, indeed. I was talking about September, which it has evolved. I think the generators, because it's mainly generators that are providing electricity, have been improved in the Mavrovuni sites. And for charging phones, there are some public accessible electrical plugs that are located in every area of the camp, and the people living there can access them to recharge their phone, given that the electricity is available. So to be honest, I don't know exactly what the current situation in the camp is regarding electricity stability, so I don't want to give information on this. But yeah, I mean, in the beginning of the building of the camp, it was very difficult indeed.
Excellent. Well, thank you. And where can we find you, just before we go, where can we find you online?
So you can reach our website, www.tsfi.org, and don't hesitate to follow us on every social network to also be very helpful for us.
Okay, awesome. Great. And you can also come to techfugees.com, and there'll be a link there to you guys. All right, well, thank you very much for joining us. We'll let you get back to work. Please do stay for the full hour if you can. If not, then I'm sure we'll speak soon, and look forward to talking about Data Hub more with you, and perhaps we can have a follow-up at some point later in the year.
Thank you. Thank you very much.
Thank you. Pleasure.
Thank you, Matthew.
Agnes.
Thank you.
Thank you, Emmanuel. Thank you, Sebastien. So we can now go, I think we'll go to Alice Piterova and Billy Zhao over at AI for Good. Perhaps could you tell us what you're doing at AI for Good, what you've been doing?
Sure. So I would like to ask my colleague Billy to just set up the screen for the demo of our tool. And in the meantime, I'll introduce the project. So first of all, let me introduce myself. My name is Alice, and I work for AI for Good. So AI for Good is a company, is a social enterprise that builds AI-powered technologies for the most vulnerable and underserved. But we also have a community of practice where we collaborate and build technologies for public good. And last year, we basically focused on COVID-19 and refugees and displaced populations. And we built a tool called AI for Good Simulator for refugee camps and IDP camps, and also other humanitarian settings. So the simulator is a web tool for NGOs, local authorities, and grassroots organizations to model COVID-19 outbreak inside a camp or a particular setting or area, and to prepare timely and proportionate response measures needed to flatten the curve, as we call it, or reduce the number of fatalities. Refugee camps, as you know, usually have very dense population. They also lack access to public health and have relatively poor infrastructure, and that makes them particularly vulnerable to the spread of the virus. The simulator helps to predict the worst possible outbreak scenarios for each new wave and their potential outcomes, and also helps NGOs design an optimal intervention strategy. So we first built the models for Moria camp last year, and we worked since then with a lot of healthcare providers, specifically in Moria, and some universities that did research specifically on epidemiology and modeling in Greece. So we actually focused a lot of our efforts on Greece and Moria camp specifically. But obviously after the fire, we were like devastated, like all of our partners, about the news. But it didn't kind of like stop us to go a little bit forward and build this tool as a universal tool for all sorts of like camps and IDP areas. So we continued working on it, and now we can present something which is working online. So Billy, I'd like to pass to you.
Yeah, sure. So this tool I think will be available for our NGO partners and other folks around in April's time. So we're still fine tuning, and this is the version that we have right now online. Like this morning, I tried to access the link, somehow it's broken. So I'm running local from now, but the online one looks exactly like this. So basically, you go to a landing page and you have like some sort of access. Here's a test account where I'm just testing out the system, and you get started. The app has two separate portions. The first portion is where you will have to input some information about the camp that you are in, assuming that you are NGO working in the camp or local authority. You want to know more about the camp, so you kind of input different information. So I've run through this just now to populate the field, but basically you need the name of the camp and the country, and this is all saved. And then when you go out and come back, all the data you have inputted before will be here. And then the next page, so this is a 4-step form, as you can see on the top. So the first step is kind of about the camp, some basic information, and the second one is about population structure breakdown. Because as you know, like COVID-19, when you are in different age bracket, you sort of are more or less susceptible to COVID-19, whether you become symptomatic or asymptomatic, whether you go on to be have a higher chance of hospitalization or higher chance of critical. So that's why we have this population structure breakdown that collects this information. And also some of the models that so you can see some of the fields are compulsory, some of the fields are optional, because we have a range of different epidemiology model that range from simple model that you probably have seen everywhere, like by now, like, you know, the flatten the curve kind of model. But we also have some more advanced, like agent-based models. So you know, assuming everyone in the camp is an agent of himself or herself, and have, you know, different tasks or different routine that they have to perform, and see how those things mingle together. So ethnicity is one of the information that will help that model, because, you know, people of the same ethnicity presumably speak the same language, will have more affinity, will be more likely to get in contact with each other, for example. So, and then you go to the next one, you will have to input some health intervention stuff. Nothing is like, you know, super compulsory here. If you already have intervention, we just adjust our baseline. If you don't have anything, we assume you don't have any measures in place. So, you know, we assume an absolute worst baseline here. And then you can just click through and, you know, input some more information, this health interventions that you have at the moment. But if you don't have anything, then again, we'll assume you are, you know, absolutely, you know, worst situation here. You haven't really done anything to combat COVID. And then you basically hit the run simulation button. And then here, a nice functionality that we have is some of the models might run a bit longer. So when you register with us, you have an email address once the model run finishes. So this kind of tells you, you know, to come back and then, you know, check it later. And here, because I just run it before, so you can see the results. We're still fine tuning this last page. So this is the second portion I was talking about, sort of showing you the results. Here, it's split in two parts. First part is kind of the sort of dashboard, some high level insights that really, you know, show you what the camp is like and different intervention, how they can affect the transmission. And the second portion is more of a formal report that you can share within the health cluster that, you know, your camp and other NGOs are in, or share to higher up, to, you know, upper local authority, regional health ministry, or whatever. So that will serve that purpose. But here you're seeing sort of dashboard thing, and then we have a few messages that were distilled, and not all the graphs are complete, but you can see there's two graphs here. Here, basically the blue curve, you know, represents the absolute baseline according to, you know, all the numbers that you are putting. And then we have simulated a few situations. For example, wearing face masks for 1 month, wearing face masks for 3 months, and then what will happen if you combine hand washing with face mask wearing for even longer time? And then this tells you, you know, having a longer, more sustainable program definitely helps here. So we're extracting messages like this from the model run that we have provisioned for you, and then show some insights on how to, you know, what's the best course to combat COVID, essentially. So yeah, that's the of the tool, and I'll hand back to Alice.
Thank you very much.
Could I just ask one question,
Sure.
just quickly about the tech? So you're using agent-based modeling, which is quite advanced, but could you explain, Billy or Alice, just what agent-based modeling is compared to traditional approaches to machine learning and AI, or kind of commonly used ones?
Yeah, I'll say a couple quick words about agent-based model. So the most prevalent model, or easiest epidemiology model for infectious disease, is called compartment model. So you basically assume a homogeneous population that, you know, you don't really specify how the transmission or infection happens. But agent-based model give you that granularity down, where you can specify, you know where someone else get in contact. For example, they got in contact in queuing up for the toilet, or they got in contact in, being the same indoor space, whether it's an administrative center or whatever. So agent-based model, you give you that granularity to model, to simulate those like infection processes. Other than like, compartment model is kind of more high level. I don't know how, infection happen, but according to some differential equations, some math, once you have a large enough infected body, they're gonna have some sort of influence over other people. Then the infection would diffuse out. That's the assumption of a compartment model. Agent-based model is
but yeah,
one level down.
You don't want to have a large infected body. You want to avoid it, right? Right. I think agent-based modeling is good because it's a kind of bottom-up approach.
Absolutely.
Yeah,
in fact, we combined 3 models, to be honest with you. So there's also a network model, which looks at how people interact as groups between each other. So knowing that some families might be very close with, other people in the camp, or they could be just neighbors and, you know, by default, you know, just knowing each other, interacting with each other a lot more. Similarly, like how, you know, young people, for example, you know, children might even not being able to go to school, but still kind of play, you know, some sports outside. So this is another thing that we look at through the network model. That's why kind of like combining the different models actually helps to see all the different dynamics in place, and this makes our tool slightly, you know, advanced, I would say, in comparison to the other modeling.
Excellent, thank you. Well, thanks for that quick tutorial on AI. I think you simplified it quite a lot. And I did interrupt you, apologies. Where were you going to go on to?
No, that's it. Like, you wanted to ask some other questions?
I did indeed, yeah. So wondering really, to me, it looks very impressive use of technology just to be able to try and anticipate this and reduce infection rates. How do NGOs use the tool? Have you had any conversations with them, I wonder?
Yeah, so we interviewed, so even in the beginning of our kind of like development phase, we did a user research, obviously, with something like 15 organizations. We worked very closely with 2 healthcare providers in Moria camp. We worked with some health providers and other kind of sanitation and water providers in Greece as well. But we also looked at other camps. So for example, we worked with a camp, an IDP camp in Iraq. We worked with some people in Uganda from UNHCR. We worked with some people in Bangladesh and Cox's Bazar. And basically, just talking to these people, we understood the needs. So how to simplify the tool and make it really kind of like responding to the needs of NGOs when planning interventions. Then we had like the alpha release, which happened in November last year. And we tested it with 5 different organizations. And the results from this testing kind of like helped us to improve the tool a lot. So the next iteration will be even more kind of like engaging and even simpler, hopefully, to navigate. And finally, now we plan to kind of like do a whole kind of shabam launch in April with the new iteration, which is the beta version, and hopefully a much better version that we can give to everyone. So this will include a lot of organizations. So this is basically why we also volunteered to speak at your live session today.
Well, thank you. Well, I hope we're raising awareness. And it's so. Have you worked with data? You've obviously had quite extensive engagement with NGOs through as you develop this. Have you been working with data sets, or have you deployed the tech as well?
So in terms of the data, so we do ask kind of like NGO partners to fill the data themselves. So this way they kind of like know that it's going to be securely stored in their personalized area. And obviously we make sure that the data that we collect is aggregated data. So there's no personal information which can kind of like be leaked or exposed somehow. We also use quite advanced like technologies that have, you know, good security firewalls, and you know, the chance of penetration is obviously very, very low. And another thing that we do tend to kind of like do in our kind of interventions with specific NGOs is that we walk them through the modeling itself. So we help them to understand and interpret the results, because this is another kind of area of ethics in technology, which is really, really important. So one thing is to give them a tool and to show them some beautiful graphs. Another issue is like how to equip them to use it. So obviously through our kind of conversations with these NGOs and our work, we kind of like help to unpack this, you know, huge area of epidemiology, which is obviously a super complex, even for us, for technologists, sometimes it's really hard to kind of like understand every single parameter, for example, for the modeling. So we do work with them side by side to make sure that they actually understand the results and they can leverage them in their day-to-day operations.
Excellent. Yeah, obviously AI ethics are a big concern. They're not always taken as seriously as perhaps they should be, but you're definitely on the case. Does that take up quite a lot of your time in terms of developing time, implementation time? Obviously, you've run models. Did you run the models already with the around the world, or were you really looking at data? That was part of my question too. It's just quite fascinating to see what you can do from one place at the moment as well, without having to be there.
Billy, do you want to answer this one?
Yeah, so we're still updating the model as we speak. As you know, like with modeling tools, like around last I think May or something, you see a lot of modeling tools pop up, and then the underlying data is through like medical studies that people have conducted. For example, the first wave of parameters really came from Wuhan, and then the second wave sort of came from Italy, and then mainly Spain, I think. So a lot of data has been updated then. So our efforts basically based on the most updated parameters, most updated medical studies, update our parameters as well, so we can tune to different regions. For example, if we just blindly use something like from Italy and then we apply it for somewhere like Iraq or Uganda, it might not work well. So there's some adjustment that we sort of look up to where, for example, one such organization that work a lot in low and middle income country modeling is London School of Hygiene and Tropical Medicine. So we look through their papers and then try to see how they do the parameter estimation, because without medical studies, you have to make some assumptions. Then we try to model our assumption as closely to the experts who have been working in this field for 20, 30 years. So we sort of mitigate it in that way.
Yeah, and to be honest, like in terms of data from the NGOs themselves, they are having hard times to kind of actually collect the data. So we've been part of a lot of seminars where like people from WHO, kind of like authorities in different countries would complain about, oh, it's been impossible to collect the data in this particular humanitarian setting because of partly we have a war ongoing in this district, and in this other district there's a lack of resources and something else. So usually there's like a problem with data, so we are trying to actually mitigate it through kind of like using the parameters from other places, but we also thought about deploying some sensors, some kind of like simple IoT technologies, something like a bracelet, for example, but we are still looking for partners to actually do it in the right way. But we would love to obviously monitor some real results and compare it with the modeling to actually see the difference or the accuracy of our modeling.
A very smart approach you have to modeling, to be able to actually sit in one place in London and look at all this is quite fantastic, really. And just thinking about that, we've discussed it really, but can you work on any size of camp, or do you have any size of camp in mind in particular? Do you need any particular layouts? I mean, just looking at Telecom Sans Frontières, we can see how camps are laid out also in your presentation, but can it work anywhere really?
Technically, it can work anywhere. So we obviously tried it with, smaller size camps like 20,000 people, 50,000 people. But the bigger it becomes, it's just like, a little bit of more compute power that we need for it. In terms of agent-based modeling specifically, where we actually look at the layout of the camp, this is where we need to work, side by side with NGOs. And get information around, how, different shelters are structured, perhaps in one street, for example, or like really spread out, or do you have a community center, situated in like left, I don't know, upper corner in the camp or something like that. So this is the only kind of model that requires this kind of like layout mapping. And the rest are kind of like very agnostic, I would say.
Okay, cool. So you're kind of looking for maps, really. That's obviously the key to it. Maybe even Wi-Fi access points, that kind of thing, wherever people congregate. Okay, cool. And then just thinking about vaccination and also other infectious diseases apart from COVID, have you had time to think about that at all, what you might do with vaccination?
Yeah, so we actually have been approached by some kind of like humanitarian organizations to look at the secondary impact of COVID, and specifically, what happened during the pandemic in terms of other contagious diseases, or like, perhaps vaccinations for other health conditions, and, how the whole kind of like nutrition and kind of like food situation impacted the population health in the specific camp area. So we definitely kind of would love to kind of like use this or reuse this modeling tool for other use cases, but we definitely need some partners that are experts in these areas, or like also like, you know, for use cases, we need some NGO partners that work in specific camps and would like to, you know, for example, explore the vaccination strategy that they have in mind and like how to deploy it correctly with, you know, optimum results, for example.
Right, because it sounds like you're into, to me, that you're into actually looking at how you will deploy this tech, how you will deploy any kind of strategy, and you're able to simulate it, right, in a way. So you can do forward planning. So I was going to ask, really, any help you need. It sounds like you've got a model that's ready to go, and perhaps some help from contribution from NGOs, again, other people in infectious diseases. So there are two things. But what else is kind of on your shopping list if I give you 200 of whatever you needed?
So we definitely need engineers. As you can imagine, like, you know, being a technical team, we definitely need engineers, like ideally with backend or, you know, anything to do with the web app, front end as well. But also, you know, people that are experts in modeling, epidemiology, in camp management. So if you're working in a camp, for example, please do come and join our team, because we would love to get some domain expertise actually, and to understand the kind of the whole complex infrastructure of like how, you know, aid is delivered specifically for COVID, you know, type of situations. So this is something that we are constantly on the lookout for.
Right. So ongoing conversation, I would say. And Louise, did you have a couple of quick questions?
Yes, I did have a couple of questions, and I see that Billy is answering as well in the chat. So thank you very much. And maybe we can take just the last question orally. I was wondering, in the work that you did with the grassroots organization, with the NGOs, to understand like the spread of the virus and what kind of measure could be taken based on data and on behaviors to protect the communities from the virus. I was wondering if you had seen or gotten some examples of measures that were taken to protect that were not effective after you study, or on the contrary, measures that have not been taken yet, but which could be effective in protecting the communities in the camp.
So I can just tell from my subjective experience, you know, working with some NGOs in Moria camp, for example, we looked particularly into, you know, one measure, which was very interesting. It was about breaking the food line into multiple parts and like, you know, spreading it around the camp. So making perhaps like, you know, some zones where, you know, people can collect food in their particular kind of like a square, you know, kilometer or like square, I don't know, 100 meters. And basically, we did the modeling using the network model. And the network model was the one that produced really incredible results in terms of, you know, it didn't change much the pandemic trajectory, this particular measure. Why? Because, you know, as we figured it out later, you know, looking close at the actual modeling results and, you know, the input, is the fact that, you know, people, i.e. like, you know, neighbors, people living next to each other would still interact, even if you create, you know, quasi zones for, you know, food collection. And that means, you know, the virus will still spread, even if you kind of like separate it into zones and make it really difficult for people to kind of like meet each other. It's still going to be the case that, you know, neighbors will talk and will kind of like pass the disease. So this is like one kind of observation that we made. We also made like another big observation there about the kind of like actual, I would say, style of deploying an intervention. So more kind of like long-term plan always helps to get the best results. So for example, if you have a lockdown for, you know, 2 months or 3 months, and then do a break, right, in the middle of it, and then kind of like, you know, start introducing shorter lockdowns afterwards, but consistently with like good information, good kind of hygiene and awareness around it. That brings much better results than to have like a 6 month long lockdown, where nobody will interact, but actually, like, you know, the other kind of, you know, mental health issues and other conditions will deteriorate a lot, and people will just continue to interact, you know, and violate the rules of the lockdown in any case. So in terms of the actual results, the first version, the first scenario was much better. So, and it was like very interesting to actually observe it. And then we saw the fire, the news about the fire in Moria camp, and we were like, oh my God, we could have, like, you know, prevented it if we would, you know, have a lot more influence on the camp managers in that particular area.
Goodness.
Thank you, Alice.
So yeah, really quite a glimpse of the future of epidemiology in a way. I work with quite a few AA projects with governments, and certainly it's coming forward, but you're certainly doing it at the moment. So you, kind of last question really, when are you going live? You did say already, but and where can we find you?
Hopefully in April. So we just, you know, want to kind of like make sure that our technology works seamlessly without any kind of bugs or issues for the first user. So like not to spoil the experience, obviously. And April is our kind of like due date. So the earlier in April, the better. In terms of where you can find us is like a website, aiforgoodsimulator.com. Please stay tuned there, because if we launch the tool, it's going to be there and all the information is going to be there. We also will announce it through our social media channels, so AI for Good UK on, you know, Twitter, Facebook, anywhere, you know, even Instagram. I think we have an account there. So we'll definitely kind of like do a big announcement, obviously through our partners and friends at Techfugees and the community that you have, guys. Yeah, that's pretty much it. That's the plan.
Awesome. So AI for Good UK on Twitter is where we'll find you. Hoping to be out in April. You'd like some developers and NGOs to talk to you anyway, I suppose. Yep. Great. And if you can't find Alice and her team there, you can find us at techfugees.com as well. We'll have information. So thanks so much for joining us. Great to get a slice of the future. Good luck with your work, and look forward to checking back with you once everything's begun.
Thank you. Thank you, guys.
Thank you. Thank you. So now we go to Mo Salah, who is in the Greek islands at the moment. Apologies, we can get to you early. We had technical issues, but hopefully we can talk directly to you now, Mo.
Thank you, Matthew. Can you hear me?
Absolutely. Yes, welcome.
Yes, great. Thank you all. So in the beginning, I'm Mo. I'm a asylum seeker. I'm on the island of Chios. Now I'm working with Action for Education. We're running a program, like we have a computer lab, and we provide digital literacy and computer skills courses. So I will go through 2 points. Like I will talk about my experience here on Chios. The first point is I will talk about the access for the internet, and the second one, it will be access for the information.
Wonderful.
So basically,
Mo too, if you have a moment, could you give us an overview of how everything is in Chios and the other islands? A quick overview of what the situation is.
Yes, well, the situation is still the same. It's still so bad. And during COVID, like people still in the camps, they, like the government so the government, they try to use the COVID as an excuse to lock the people in the camps. They can't go out, they can't go in, like it's really horrible. But they also trying to empty the camp. They're doing a lot of transfer to the mainland. During the last 2 months, they transfer like 6 and 50% to the mainland.
Right.
And lockdown, we had a lockdown. Now we're still under lockdown, but like a relaxed lockdown. We need to send an SMS to go out, and
Okay. Well, thank you for that overview. Very valuable. Please do tell us about your work at Action for Education too.
Yes. So Action for Education, we are grassroots NGOs working on the islands of Chios and Samos basically now. Yeah, we have a computer lab here on Chios, and we have another computer lab on Samos. So what I noticed in our centers in the computer labs is basically like people our students, most of them, or let's say 60%, they know nothing about the internet. They know nothing about getting the information. Yeah, like they are. Yeah, when they see computer, they are just like, what is the computer? We don't know.
Right.
Like when we did the reach out to them, like we're providing digital literacy, they were asking, what is the digital literacy? So I will leave this, but let me talk about the access to the internet. So on Vial camp, there is no Wi-Fi. No one provide Wi-Fi. Like as far as I know, there is like no NGO, no one provide any Wi-Fi. And yeah, people just use the SIM cards, like local SIM cards for the phone, or like mobile data, which is really, really expensive. And yeah, so in our centers, we provide Wi-Fi, but if during the lockdown, what the NGOs did is we were like top up their SIM cards just to deliver them the classes through Telegram or through WhatsApp.
Right.
So this is something I wanted to mention is, I'm not an expert, but rather than set up a Wi-Fi in the camps, I was thinking if we can like collaborate, or if someone can do this, we can like reach out to the companies, like the telecommunication company here, and if we can find, it's not a refugee SIM card, but like, yeah, a SIM card who's only can asylum seeker or refugee buy it with the internet package, like cheap, and we don't need it to be like unlimited data, which like
Right.
they can use WhatsApp, maybe Google Map, maybe email, like the basic things that they need. This is yeah, a small thing, maybe
A priority, because it's
Yes.
obviously a big barrier to getting on the internet is obviously the cost, right? So luckily in Moria we have Wi-Fi operation we've just been referring to, Telecom Without Borders, but not everywhere, and it sounds like it is very expensive, and it is a barrier. People are not able to access the internet, right, because of cost.
Yeah.
Okay.
Yeah.
So
yeah.
well, that's an appeal basically, yeah, to telcos. That's something that would really, really help, right? It's the basic services, essential services on the internet. It's something that would definitely help.
Yes, exactly. Yes.
Okay,
And
so we're asking for that.
Yeah. The second thing is access to the information. Well, in our centers also, they can come and they can use the internet. They have computers, they have internet, but they can't access to the information because there's many websites provide information and provide like a guideline for the refugees, but they don't know, as I mentioned before, they don't know what's the internet browser. They don't know what is that, like they don't know how to access to this thing. And I noticed that the easier thing for them to use is the applications on the phone.
Right. Yes.
And we don't like personally, I don't prefer the social media because it's full of rumor, and when they get a Facebook page, they read to get some information, it's full of rumor, and it's like we can't trust this. So there is yeah, I wanted to, like, if we can provide applications for these websites where they can easily find this information and they can easily access.
It's because I know we spoke before about, you know, the key barriers, and it was, there is so much information out there, right? Is it a problem of how do you choose it? You know, what's the essential information that people really need? And again, now it's difficult for them to access on a browser. So it would matter really of putting the right information together in one place, which isn't particularly on a Facebook or other social media site, right? So this is what you're teaching people to do in the Media Lab.
Yeah. So yeah, basically, yeah, we teach them like really the basic, the essential thing, like how to, what is the internet browser? How can I access to the internet? How can I access, like example, how can I find email of the asylum service on Chios, on Athens? How can I find all this contact? Yeah, we just like, but it's still limited here because it's still limited. Like I can do only this with like our students who can access the service here. Yeah, and like our service, it's in the city and it's far from the camp, and not all the people can join, not all the people can have access for this.
But if you had a bundle service, which was on an app, or was easy to access, people would be able to do it from their mobile, right? Without any tuition.
Yes. So most of my students, they were come like they were all show me like application for something, like they are familiar with the application. They can easily find it. They can easily, like the interface of the application, it's so easy to find everything. Which when you open a website on your phone or on your laptop, like for someone who doesn't know all these things, he will be lost, like a lot of thing, and I don't know what to do.
Yes. And I know we spoke also about access to government websites, which are quite essential. Again, it seems it's a big barrier, right? I guess the government websites are difficult to access anyway. They're in Greek. Translation, is that a need?
Yes. So as I said before, like to find a contact for asylum service office or a tax office or all this contact, like you need to go to the governmental websites to find them. You can't find them anywhere else. So the websites is really, I went through them, it's really complicated websites, and they're all in Greek language, and some of them you can find like in English language, but still like really complicated for a normal user to find what I want. Again, for a person who know nothing about the internet, is impossible for them to find all this information.
So again, some translation, some consolidation. I mean, at the data hub, we're trying to bring data together in a sensible way that makes it easily accessible, but it sounds like translation is needed, which is something which we've helped with before with other organizations. And also, Mo, sorry.
I wanted, maybe we can, if we can like provide a guideline for this website, which is really, it will be useful. A guideline just to make it easier for a person who doesn't know how to use the internet, who doesn't know how to, just to break it down.
A guide and a walkthrough would be helpful. Would make a big difference. Really, I'm so glad that you're able to speak to us today and really tell us. We often work with organizations, working with people, but you're working directly on the ground and you know exactly what's needed. So thank you very much, Mo, for bringing this to us. And I say to everybody out there, if you do know how to bring information together, if you can help with translation, then please do get in touch with the Techfugees, and also with Action for Education, and also around telcos. Very big appeal there in terms of giving people access to data. It sounds like it really would help a lot. So very glad to discuss that.
I do have a question for you, Mo, and I know that Alexis also has. So Alexis, if you want to open your mic right after, feel free to do it. I was wondering if you knew refugee about the web app Refugee Info Greece, which has been working for I'll just share my screen rapidly. So it's a web application to gather information about asylum seeking in Greece, and with list of contacts. And I was wondering if you think it would be relevant to get in contact with them.
This website, it's in my curriculum in the computer lab. I teach the students about it, and I show them this. But it's a still website, it's a still website. Like when they open it through their phone, like if you open it now, if you open it through your phone now, it's really mess for them. Like, where am I? What should I do?
And then but just some more work on bringing it into more of an app format, right?
If we can have it as a application form, is perfect. And there's another website called Migrate News, I think. It's specific for the news. Also this one, if we have it as an application,
It's thank you for saying this. I'll connect you with one of the person at Refugee Info Greece, because I know that when they started with an application that wasn't used at that time because it didn't work as an app. So it would be maybe possible to work on another app version that would be useful. Thank you, Mo. And
thank you.
I know Alexis had another question, so Alexis, if you want to jump in.
Sorry,
We can't hear you.
Yeah, we can hear you. No, Alexi, don't worry. You did write some questions down. I'm happy to read them. I'll read them anyway. Maybe you have another one whilst your mic's coming through. But you're asking, Mo, really, do you recommend any specific applications? So any specific apps, any you brought together? He's talking about Funzi, Colibri for offline learning. Alexi, are you there?
I think it's working now, is it?
Yeah. Yes,
okay. You know, I know that Funzi had done exactly that a few years ago, but I don't know whether they still do it. So it's an app, Funzi, and they do mobile learning, but they also had a course that was specifically designed to answer questions that refugees might have on the Balkans route, with information country by country. And that's an application that they can access on their mobile. And Colibri is an offline repository where there's curated content that is aligned with a curriculum of the country where the community is based. So whether it's in Kenya, in Greece, in Jordan, it's specifically designed at communities that are remote learning, or that are addressing issues of digital literacy and having to learn online, but without the skills, the necessary skills to curate their own content. So it's done by an NGO called Learning Equality. Can put you in touch if you want.
Yeah, thank you so much.
Excellent. So we already have some answers. The conversation worth having. Thank you, Alexi, for those answers there. I hope they're useful, Mo. And the conversation continues. Sure. Awesome. And the conversation continues too on our data hub. So you can find us at techfugees.com. We will come back to the Greek Islands. And Mo, where can we find you at Action for Education?
Well, yeah, you can visit the website, actionforeducation.org. Yeah?
Yes, that was what I was looking for. Perfect, great. So actionforeducation.org, we'll find you there. And we look forward to continuing to our conversation and everything around Data Hub, and hopefully we can catch up again next time we come back to the Greek Islands. All good. Sorry, I think you've gone on mute now. Yes, still on mute. Okay, perfect. So thank you so much. Just saying thank you for joining us and look forward to catching up with you again. Perhaps in another
thank you.
Live session.
Thank you for managing this session. Thank you.
Pleasure. So thank you to everybody. We've run slightly over the hour, but I hope you stayed with us. I hope you found it really informative. Please do find us at techfugees.com, where you can see our data hub, where you can also see the work we're doing with these organizations. And if you can help anybody with any resources that they've mentioned today, please do. And also we have tfdatahub.org as our data hub, which you can also find at techfugees.com. I don't know, Louise, did you have anything else to sum up?
No, thank you. Thank you everyone for being here today. We'll share the video. I'll stop the recording. And if you, for Telecom Without Borders and for AI for Good, if you have job description to share, you can share it as well on Techfugees Facebook group. There might be people who watch the video who will be interested in monitoring as well, or connect with Mo, and we'll share a recap on our website very soon. So thank you very much for your time, and congratulations for your work. I wish you a good day.
Thank you.
Thank you.
Thank you.
Amazing.
Thank you.
Thank you very much.
Thank you. Take care, everyone. Bye.